Hello everyone, my name is Dr. Punit Garg and I'm a consultant pediatrician at Adarsh Hospital, Malad West, Mumbai.
Hi, I'm Dr. Aditi Goimawala, also a child specialist from Mumbai. In the previous video, we have discussed about the principles of starting solid feeds in children.
In case you have missed that, the link is provided in the description box below the video. Now we are going to go into the details and specifics of complementary feeding for your child. As we have said before, the process of complementary feeding should start at the age of 6 months and ideally be completed by the age of 1 year, when the child should be able to eat the entire family food. So on your screen you can see a table which tells you about the frequency of complementary feeding and the amount of the feed that the child needs per meal, as well as the consistency or the texture of the food that needs to be offered. So from the ages of 6 to 9 months, we need to offer at least 2 to 3 meals of complementary feeds per day, and after 9 months it's minimum of 3 to 4 meals per day apart from breastfeeding. The consistency of food that is offered to the child should be gradually increased from semi-solid to mashed and finally to solid foods, and you can see in the table the amount of feed that you need to offer. The process of complementary feeding is divided into 3 stages. Stage 1 is the period between 6 to 7 months, stage 2 is between 7 to 9 months, and stage 3 is 9 to 12 months. In stage 1, you can offer your child pureed, mashed or semi-solid foods. After cooking the food, you can mix it and grind it with a mixer and strain it. Try to avoid grinding or blending with a mixer after the age of 7 months, otherwise the child may not learn how to chew the food. On the right hand side of your screen, you can see a photo which depicts the ideal consistency of the feed. Now, a very commonly asked question that we often encounter is what should be the ideal timing of the feed, whether it should be before the milk feed or after. So the practical solution to this is to first offer the feed that the baby is used to, which can be either breast milk or formula milk. After the baby has consumed some amount of this, you can then offer the mashed or solid food, and after that, if the baby is still hungry, the remainder part of the breast milk or the formula feed can be offered again. The reason for this is that if we directly offer the mashed or solid food, the baby may not be in the mood to accept it. Also, if you offer the mashed or solid food after the completion of the breastfeed or the formula feed, the baby may not be hungry enough to try the new feed. So initially the ideal timing should be between 2 portions of the breast milk or the formula feed. Later on, as the baby gets used to that particular food, you can start with the food first, followed by milk. So what foods can we start off with? You can start off with any food which is culturally and economically acceptable and is available locally, and it may be of any of the following groups: vegetable, fruits, cereals, dals, as well as animal products such as meat, poultry, fish and eggs. Animal milk should be avoided up to the age of 1 year, but it can be used as a base to prepare other complementary feeds. You can offer the child plain yogurt. These are some of the variety of options that you can choose from. As opposed to what was advocated earlier, gluten containing foods such as wheat, rye, barley and oats can be introduced early on in the process of complementary feeding. In fact, if they are offered while the child is breastfeeding, they may even reduce the risk of gluten hypersensitivity and celiac disease. Also, earlier it was advised to take animal products such as eggs, fish and meat after the age of 9 months, but again latest reports have suggested that these can be started right from the beginning of the weaning process. New foods can be offered to the baby every 4 to 7 days, as it gives time to adjust to the various flavors and textures. Please keep in mind that any new food should always be offered in the daytime, because in case a child develops any allergy to it, you can instantly visit the doctor. Now coming to stage 2, which is the period between 7 to 9 months. The main difference here is that you can give lumpy foods, that is after cooking the food, you can mix it with hand, fork or mixer, but do not strain the food so that there are small soft lumps. Please keep in mind that teeth are not necessary for chewing lumps. Always keep your baby in the upright position while feeding them, as it reduces the chances of choking. On the screen, you can see a chart of the food items that can be given between the ages of 7 to 8 months. Sips of water from a cup can be offered to the baby when they have started eating lumpy foods, because they will need some amount of water to satisfy their thirst along with the meals. The daily water intake for infants and young children is now mentioned on the screen. Finger foods can also be offered to the baby starting from 8 months of age. Now coming to the final stage, which is stage 3 between the ages of 9 to 12 months. Now we can start the child on solid foods. Minced and chopped foods can be introduced along with harder finger foods such as raw, ripe fruit and even vegetable sticks. These are some of the food preparations that can be given to the baby in stage 3 and beyond. After 12 months of age, the full family feed can be given to the child. Only precaution that you need to take is to avoid foods such as nuts, which can cause choking. Breast milk normally contains 70 kilocalories per 100 ml. When we give complementary feeds, they should contain at least 100 kilocalories per 100 grams. That is, complementary feeding should be more energy dense. This can be achieved by adding things like coconut oil or ghee, jaggery or gur, and also small amount of sugar. And you can also ferment and germinate food preparations to increase the protein content. Please be careful to avoid giving very watery or dilute foods like rice water or dal water or fruit juices, as they contain very less number of calories per 100 ml, and this can cause growth retardation and malnutrition.
So that's all for today. Hope you liked our video.
If you have liked it, please do share and subscribe to our channel and follow us on Instagram as well. The link is in the description box in the video. Till then, cheers and see you in the next video.
Thank you.